Good evening, guys. I have discussion D for you. We're discussing Philly's senior transit problem for seniors. So we're gonna dig into that for discussion D. Please join me for tonight's discussion D. Here we go. Philly's walkable streets and public parks offer older residents chances to stay active, but public transit and accessibility pose challenges. Captures a tender attention at the hearts of aging in a historic, densely built American city. It signals that Philadelphia already has many of the indigenous ingredients associated with healthy aging: compact neighborhoods, sidewalks that encourage movement, and abundant green spaces. Yet these strengths are undermined by structural barriers that make it harder for many older adults to fully participate in city life. The headline sets up a notion story, not a celebration, not a critique, but an honest look at how the city's environment simultaneously supports and restricts older residents' independence. It invites readers to consider how the same streets that energize some seniors can isolate others. What the surrounding article emphasizes. Walkability and parks as major assets. Philadelphia's street grid, dense neighborhoods, and pedestrian-friendly layout make it one of the most walkable cities in the country. The article notes that 95% of residents, including 94% of older adults, live within a 10-minute walk of a park. The city's historic squares, Fairmont Park, and neighborhood green spaces offer built-in opportunities for movement, socialization, and outdoor exercise. These features mirror some of the environmental strengths found in blue zones, where daily movement is woven into everyday life. For many older adults, simply living in a walkable neighborhood increases the likelihood of staying active, maintaining balance, and preserving independence. 2. Transit and accessibility as persistent barriers. The article also highlights the other side of the equilibrium equation. SEPTA service cuts fare changes and reliability issues make it harder for older adults who make up a significant portion of riders to reach medical appointments, grocery stores, or social activities. Uneven sidewalks, historic cobblestones, and missing or broken curb ramps create daily hazards for people using walkers, canes, or wheelchairs. Many historic buildings are exempt from full ADA compliance, leaving seniors unable to access services or community spaces. These barriers don't just inconvenience older adults, they can reduce physical activity, increase isolation, and limit access to essential care. Neighborhood inequities. The article stresses that not all Philadelphians experience the city the same way. Parks in lower income neighborhoods tend to be smaller and lower quality. Sidewalk conditions vary dramatically by zip code. Transit reliability is uneven across the city. This means that the benefits of walkability and green spaces are not distributed equally. Why the situation is complicated. These environment supports active The environment supports activity, but only for those who can access it. A city can be walkable on paper, yet inaccessible in practice. For example, a park may be nearby, but the route to it may involve cracked sidewalks or steep curbs. A bus may be free for seniors, but unreliable service or inaccessible stops make it unusable. A neighborhood may be dense and vibrant, but without benches or shade, older adults can't rest when needed. The article shows how small design flaws accumulate into major barriers for people with mobility limitations. Transit is both a mobility tool and a health tool. Reliable transit doesn't just move people, it keeps them active. Walking to and from stoops adds daily movement, and transit access reduces loneliness by connecting older adults to community centers, parks, and social networks. When transit falters, so does health. Historic charm versus versus, versus modern accessibility. Philadelphia's cobblestones, narrow alleys, and historic buildings are parts of its identity, but they also create functional friction for aging bodies. The city's charm and its challenges are intertwined. Concrete examples from the article. Sidewalks. Many are uneven or lack curb ramps. Through a recent settlement, though a recent settlement requires the city to install or fix 10,000 ramps by 2038. Transit. Older adults ride SEPTA frequently, but service cuts and funding instability have made the system less dependable. Parks. While access is high, quality varies, and sometimes neighborhoods lack safe walking routes to reach them. Community centers, programs like the Senior Housing Assistance Repair Program and the Caregiver Support Program help older adults stay independent, but access depends on transit and neighborhood conditions. These examples illustrate how the city's strengths and weaknesses intersect with daily life, policy, and planning implications. The article implicitly argues for a more holistic approach to aging-friendly design. Invest in universal design, smooth sidewalks, reliable curb ramps, shorter crossings, benches and shade structures, strengthen transit, improve frequency, accessibility, and reliability, ensure stops are safe and sheltered, access inequities, prioritize improvements in neighborhoods with the greatest mobility barriers, support community programs, expand senior centers, evidence-based exercise programs, and home repair initiatives that help older adults age in place. These changes would not only benefit seniors, they would improve the city for everyone. Practical takeaways for residents and caregivers. Map the safest, smoothest walking routes and identify parks with accessible paths and seating. Note which transit stops are easiest to use and plan trips around the most reliable routes. Advocate for specific improvements. A repaired curb ramp, a new bench, a safer crossing, because small changes can dramatically expand an older adult's world. Use community centers that offer free or low cost exercise programs designed for older adults. Okay, guys, that is your D for tonight's. I will see everybody tomorrow for shows. Till then, Gator Wellness, take care, folks.